You've probably heard that Medicare now has a Part D cap as far as out-of-pocket costs for your prescription medications. But what does that really mean to you? And what about the Medicare payment prescription plan? And how does that actually save people money? And the truth is that most people misunderstand what that actually means to them. Today, I'm going to break down what the $2,100 cap is for the Medicare Part D program, the Medicare payment prescription plan, what changes as of 2025, and most importantly, who benefits from these upgrades and who doesn't. Hello, my name is Edwin John Rodriguez, your licensed health insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients compare, understand, and enroll into plans that fit their needs and goals. I often say to my clients, I'm the best free help you'll never pay for. And as a quick reminder, the best prescription is a subscription. So if you're not subscribed to the channel, please do so. Now let's get into it. What is the new $2,100 cap? Well, this actually started in 2025 for the Medicare Part D portion of your coverage. In 2025, that is a $2,000 cap. New for 2026, that cap is going to be $2,100. But what does that really mean to you? What that means is once a beneficiary spends $2,100 in the year towards their medications, they're going to hit this cap, which is a limit as far as what you spend out of pocket for your medications. That's not a limit as far as what the insurance company is going to spend. It's a limit as far as what you, the consumer, will spend in the calendar year for your medications. Now, the items that go towards this limit are going to be any deductibles you have related to your prescription drug plan, any co-pays, which is your set dollar amount that you pay for your medications, your co-insurance, which is any percentages for those prescriptions, that all goes towards your catastrophic coverage. Now, after you hit that cap, your cost of your medications will actually be $0 for the rest of the calendar year. This is actually the biggest change for Part D drug plans since 2006, when the federal government required that individuals on Medicare have to have drug coverage. So the only thing that changed for 2026 is actually the amount of that cap of $2,100. Again, in 25, that was $2,000. But to cover some items that did not change in 2026, are going to be your monthly premiums. These can still vary from plan to plan, depending on your medication needs, your preferred pharmacies. Helping choose which drug plan makes best sense for you is really going to come down to, of course, your medications and preferred pharmacies. Now, formularies can still differ from plan to plan. So even though a medication might be covered well on one plan, doesn't necessarily mean it's going to be covered well on another plan. So doing your due diligence and shopping your drug plans definitely makes sense. You still want to make sure you compare your drug plans on an annual basis. Now, part of these changes for the prescription drug plans for 25 and going into 26 is going to be the Medicare Prescription Payment Plan, also known as the M3P program. So what does this actually mean to you? What is the M3P program? Well, instead of paying $500, $600 in January for your prescriptions, $300 in February, $800 in March, and eventually hitting that cap possibly halfway through the year, what happens is with the M3P program, you can actually spread out the cost of your prescription medications for the calendar year. So rather than being front-loaded higher end costs in the beginning of the year, they'll spread your costs over 12 equal months of $2,100 divided by 12 months comes out to $175. You know exactly what to expect all year long, helping making sure that your prescription costs are manageable, palatable, and of course, you know what that number is going to be. This is not a discount program. It's a prepayment arrangement that you make with the insurance company. This program is not automatic. You're going to want to reach out to your insurance provider by the end of the year and let them know, whichever carrier you're with in the new year, just reach out to them and let them know that you're going to be requesting to join the M3P program. Again, it's totally free. The way it works is just by registering with the insurance company, letting them know that you're requesting that, and they'll work out the arrangements and the details in the back end. The biggest misunderstanding people have about the M3P program is that it will help reduce their drug costs. Well, it does not. Unfortunately, the cost of your medications are still the cost of your medications. But what will happen is, again, you're going to spread out the cost of those medications over the 12 months. So the truth is that the cap actually creates a maximum that you can pay in the year for your medications. The M3P program changes when you pay, not how much you pay. Who actually saves from the $2,100 cap? Most people who take high cost medications, especially like cancer medications, autoimmune disorders, diabetic injectable medications, and very popular specialty medications are going to be really high cost drugs. They can range anywhere between the high hundreds to multiple thousands of dollars. If that's the case, and as long as it's a covered medication on your plan, you'll have that cap as far as what you'll spend in the year. People who have historically hit this catastrophic limit in previous years will be folks who would benefit from this program. People paying thousands of dollars annually in prescription costs. For example, I recently had a client who was spending about $4,000 a year on medications prior to 2025. They're one of the biggest beneficiaries of this $2,100 cap. So they're not having to spend that $4,800 a year anymore towards their medications. They're going to be capped at that $2,100. And in contrast, who does not save from this $2,100 cap? Of course, people who aren't actually hitting that cap, right? If you only take basic generic medications, this cap really is not going to affect you. If your plan already covers most of your medications at little to no cost, again, this is not going to affect you. Some people may even pay slightly higher premiums because of this, because the insurance companies are going to be absorbing more of the risk. A little side note here, probably shouldn't be saying this on camera for YouTube, but I'm going to probably say it anyway. This is a little insider tip that I've come across. Whenever you're shopping your Part D drug plans, remember the premium of your plan doesn't go towards your maximum for the year. Okay, so as a pro tip for my clients here, remember that the premium that you pay for your medication plan is not going to go towards your total for the year of that $2,100 cap. For my clients, I tell them, like, why pay more money for your drug plan just to have lower co-payments? Because what you're paying out of pocket towards your medications is what goes towards that cap, not your premium. So again, as I stated earlier, your premium's not going towards that cap. Why spend $100, $200 a month for a drug plan when you can spend that $100, $200 a month on your prescriptions, hit that cap halfway through the year, and be done with your medication costs? My pro tip for you is don't focus so much on how cheap your medications will be based on the plan. Focus on how quick you can get to that $2,100 cap while keeping your lower premiums throughout the year. Of course, if you have any experience with this M3P program or hitting that cap, go ahead and drop a comment in the comment section below. Tell me what your experience has been so far with the M3P program or hitting that catastrophic limit. Has it helped you? Has it hurt you? What are your thoughts? I'm interested to know. So another question I get is, who really benefits from the M3P program? Again, being able to spread out those medication costs throughout the year. So people with high medication costs that may spike throughout the year, maybe folks who have varying costs of medications. A common one is Prolia. Maybe they're not taking that every month. That's normally a every 6-month medication. So someone who's going to have a spike in costs throughout the year in different medications would definitely benefit from the 3P program. Anyone on a fixed income that needs predictable monthly costs for their medications, it's a good idea to consider the M3P program as well. I was speaking to one of my clients who was shopping her plans for the new year, and she was worried about the increased cost of one of her prescriptions, a common medication called Eliquis. That medication was actually going up to over $100 a month for her when previously it was $47 per month. She also had a $600 deductible that she had to meet first before the plan was going to help out with that medication cost. I reminded her about the M3P program, explained to her how to register with the insurance company to then be able to spread out those costs evenly throughout the year. That wasn't the only medication she was taking. She had a handful of other medications that were also going to have some costs associated with it. But at least she now knows how to spread those costs evenly throughout the year and cap as far as what those costs will be for the year. Who should avoid the payment plan? You don't necessarily have to avoid it. Again, it's not automatic. You just have to call customer service to enroll into the programs. It's not a fee-based program. It's totally free. It's a way the insurance companies are helping folks out with managing and monitoring their costs through the year. People who prefer paying up front for the medications, they don't have to worry about registering for the M3P program. Also, people who don't like monthly billing adjustments, you don't have to worry about getting set up with a payment plan with your insurance company. You just go to the pharmacy and purchase your medications like you normally would. Other folks who don't necessarily need the M3P program would be those who don't hit high spending levels. If you have just basic medications, just a handful of drugs that are common tier 1, tier 2 generic medications, you're most likely not going to hit that limit for the year. No point in registering for that program. Also, people who might forget about bills, right? If you set up for the M3P program, the way it works is the insurance company is going to start billing you for your medication costs. Assuming you're hitting that $2,100 cap, insurance company is going to send you an invoice monthly for your medication costs. Assuming you're hitting that $2,100 cap, $175 per month you'll be getting billed for on a monthly basis. But if you're a person who forgets about your bills and you want to avoid late fees that may be incurred, another kind of client who may not benefit from the M3P program are folks who may forget about paying bills, right? Because again, with the M3P program, the insurance company is actually going to be billing you monthly for those prescriptions rather than actually paying for those prescriptions at the pharmacy. Now, late fees may apply if you are paying those bills late from your insurance company for these prescriptions. Just keep that in mind. If you do set up the payment prescription plan, to make sure you have that saved and reminded in your calendar. The real question is which one actually helps me more? Is it the cap or is it the payment plan for your prescriptions? The short answer is not really one versus the other. It's actually they work together. The purpose for the cap is going to cap how much you spend in the year towards your medication costs, versus the payment plan is going to help you create monthly budget as far as how those medication costs are going to be coming out of your pocket. Now, both matter and they both help with managing your medication costs. Now, the way we help out our clients here in the office is we review your medication list based on your tier levels. We look at your historical out-of-pocket totals, so what you've spent year to date in previous years, and we compare whether you'd hit that cap next year depending on those medication trends that you've had in previous years. We can run scenarios both with and without the M3P program. We can determine to see if it makes sense to spread out your costs throughout the year, or if it makes sense just to kind of take an upfront hit in the beginning of the year for those medication costs. So now you know how the Medicare Part D $2,100 cap and the Medicare payment protection plan really work for you and who actually benefits from these changes. If you found this video helpful, go ahead and give it a like. It really helps other people find this kind of honest guidance. And also be sure to hit the subscribe button so you don't miss future videos. Insurance rules and options are always changing. And if you're subscribed to the channel, we'll keep you informed and up to date as this information comes out. So if you're thinking about switching your drug plan or your Medicare Advantage plan for the new year, feel free to give us a call. We can walk you through some options to see if there's any improvements available to your program. So there's no pressure in this process, no sales pitch, just clarity related to your specific needs and goals. And if you're looking for a trusted guide and helping you navigate your insurance from start to finish, that's exactly what we're here for. If you got value from this video today, consider watching this video here next for more information regarding your Medicare options. Until then, take care and thank you so much for watching.